first. Joining us now is professor at Northwestern University Medical School and our morning news contributor, Dr. Lauren Streicher, to answer some questions. Good to see you again.
Good morning.
Good morning. Good morning.
All right, let's start with vasectomy numbers are picking up, but there's still many myths.
Yeah, so after the Dobbs decision, tubal ligation numbers doubled, and now we're seeing the same trend with vasectomy. But what's interesting is you kind of think of vasectomy as older guys, maybe people who finished having kids, but the trend is that young men who've never had kids in their 30s are all lining up to get their
Why is that?
vasectomies. Well, there's a lot of reasons. A lot more people are just choosing to go child-free. The New York Times did an article on that just a little while ago, but also people are realizing that depending where you live, it can be really catastrophic or life-threatening to have an unplanned pregnancy. But the truth is that it is so much less risky medically to have a vasectomy compared to a tubal ligation that this is actually a good trend if a couple is looking to have permanent sterilization. But if you are on the fence, there are so many myths that are still floating around out there about vasectomy, starting with that guys think that this is really going to have a negative impact on their sex life, which it does not. It in no way impacts on the ability to perform or libido or anything like that. A lot of people think that this is going to decrease testosterone levels. It has nothing to do with your testosterone levels. You know, you're blocking the roadway for the sperm. You're not blocking the hormones. This idea that it's going to be a terrible recovery or you're going to need anesthesia. I don't want to minimize the snip, but I'm just saying this is a very quick, easy outpatient procedure under local anesthesia. It is not going to increase your risk of cancer, specifically prostate cancer, and it is not going to increase your risk of heart disease. The main thing that people need to know is when you do this, you know, it's not intended to be reversible, but it is more reversible than it is for the women. A lot of it depends on not only skill of surgeon, but how long it's been. And insurance is not going to cover a reversal. So you really need to go into this knowing that this is what you want. And if you're young, it's kind of tricky.
All right, menopause and body aches.
This was a big article that came out in the New York Times this morning about a new syndrome called musculoskeletal syndrome of menopause. And there's an orthopedic surgeon, Dr. Vonda Wright, who's a good friend of mine. And in fact, I did a podcast episode with her, who was highlighted in the New York Times today because her point is, and her research shows, that women are kind of expecting to get, you know, the hot flashes and brain fog and insomnia and all that, but no one tells them about the achy muscles and the joint pain and the bone issues. And she has identified this as being a consequence of lack of estrogen, things like frozen shoulder. And certainly I found in my practice when a woman would decide to stop hormone therapy for some reason, the number one complaint wasn't hot flashes, it was like, oh my God, I can't play tennis anymore. Everything hurts. So she has identified this. She's talked about the things that people can do to prevent it. But what the New York Times did not cover, that we had a long discussion about in the podcast, is it's not just about those aches and pains, it's the association down the road with cognitive function, frailty, ending up in a nursing home. So it's really important to be aware of the hormonal changes that occur throughout your body, not just in all the places you're thinking about.
Testosterone for women.
Yeah, you know, testosterone isn't a male hormone, it's a human hormone. Women make testosterone and use testosterone just as much as men do. And there's been a real push lately for a lot of women to ask about testosterone supplementation as part of their hormone therapy cocktail. Now, I want to be clear that testosterone for women is not FDA approved. However, it is readily available from compounding pharmacies. You do need a prescription. But the real question is, what's it going to do for you and what is it not going to do for you? Because if you go on social media, I mean, the list is long of things that testosterone is supposedly going to do for you, starting with, you know, libido, your sex life, muscle mass, mood, decreasing depression. Is it going to help with your bones? Is it going to help with cognitive function? All of that stuff. And if you look at the studies, and you know, a new one just came out looking at what it's really going to do for you, we know that the one thing that it will do for about 50% of postmenopause women is it will boost libido and sexual function. But all that other stuff has not really been proven. There's some emerging data, but you gotta know what you're doing. You gotta be careful.
Yeah.
You know, because I mean, you don't want to be borrowing your husband's razor or suddenly having male pattern baldness or other physical changes that are, quite frankly, irreversible.
Well, talk to your doctor and not TikTok.
And you exactly.
Okay.
And you need to maybe be careful about telehealth. You know, go to something like a MIDI health that's trusted, and you're going to get the right stuff.
Got
and
it.
you're going to follow your levels. Yeah.
All right, top lies patients tell their doctors.
You want to guess?
I said, like, I'm on a
Exercise.
diet or I exercise every day.
Diet, exercise, habits, that's like number 2 and 3. And the main reason that they lie about that kind of stuff, of course, is they don't want to be judged.
Right.
But it's not the number 1 lie.
And what about number of drinks a day?
That the number of drinks a day is huge for men.
Okay.
Men are the biggest liars when it comes to how much they've had to drink, particularly young men.
What about
particularly men.
women? What's the biggest lie?
The biggest lie is their exposure to multiple partners and sexually transmitted infections. Because when the doctor says, hey, how many partners have you had? Do you want an STI screen? The guys are happy to say, oh, yeah, sure. I'm like, been with a lot of people. Where women, even though the statistics are that they have just as many partners as men, women are more likely to say, oh, no. You know, I'm married or I'm in a relationship. And look, when I was practicing, our general approach to this was never to say, how many partners do you have? Who cares? I would just ask every single person, married, single, doesn't matter, would you like an STI screen today? But most doctors don't do that. They start off by saying, do you have more than one partner? And then women feel like they're going to be judged because societally. Yeah. So, and they're more likely to lie to a young doctor than an older doctor. And overall, when you look at all the lies that people tell, it's generally the women that are lying more than the men, except for the drinking part. But the number 1 lie, one lie that patients tell is that they followed instructions and recommendations. So if your doctor sends you out the door and says, okay, your shoulder hurts, do this exercise 10 times a day. And then when they come back, they say, did you do your exercises 10 times a day? And people, yeah. It's not working. I don't know why.
Right.
But, again,
interesting.
they said that it would be insulting to the doctor to say that they didn't follow recommendations.
Well,
So
you can
there
check.
you have it.
That's awesome. Check out Dr. Stryker's Inside Information podcast, Menopause, Midlife, and more. Thanks for being here.
Thank you.
Thank you. Time for Around Town.
Hey, Anna.